This week's episode features Dr. Vanessa Barrow. She is a podiatrist and the founder of her private practice, Soul Aesthetic, located in Houston, Texas. She joins us today to share her incredibly inspiring journey into this unique field and to talk about the modalities that she offers to her patients as a foot and ankle specialist. There have been quite a few requests to highlight the field of podiatric medicine, so I would truly hope you enjoy listening to today's episode. If you like what you hear, leave a comment or a review or share with a friend, someone that may need podiatric medicine or may be interested in the specialty. This podcast is sponsored by Picmonic. In 2011, two medical students came up with the ingenious idea to combine medical education with unforgettable characters and ridiculously memorable stories. Featuring over 35,000 high-yield facts and graphics, Picmonic has helped over 600,000 students improve exam scores and perform better clinically. Picmonic has resources for pre-med and medical students, as well as other healthcare professions. Check out the show notes for a link to their website. Mention the podcast when you subscribe. With Picmonic, you can study less, but remember more. Hello, I'm Steven, host of the Black Doctors Podcast, here to talk about Clove. Clove is a sneaker specifically designed to meet the needs of healthcare professionals. I have a pair and I love how comfortable these shoes are, especially since I'm on my feet all day as an anesthesiologist. These shoes are perfect for the operating room because they are extra grippy and super easy to wipe clean at the end of the day. Purchase any pair of Clove shoes and compression socks. At checkout, use the code BDPXClove to get your socks for free. A $22 discount just by listening to the show.
The Black Doctors Podcast highlights the stories of minority professionals with the goal of inspiring others. If you like what you hear, please subscribe and share with others, because the next generation can't be what they don't see. Tune in every Monday to hear our stories told by us.
Hello and welcome back to the Black Doctors Podcast. I'm Steven, your host. So excited to be speaking with a very special guest this week. This specialty has been requested multiple times, and I've looked high and low to find someone with this background to come on the podcast. I'm speaking today with Dr. Vanessa Barrow. She is a podiatrist currently practicing in Houston, Texas. Dr. Barrow, thank you so much for joining us.
Thank you for having me.
So I've followed you on Instagram for a while. You have fantastic social media. You're really kind of giving us a behind the scenes look of life as a podiatrist. So I'm really excited to find out more about what you're up to.
Okay. You know, one of the things that's important to me and my private practice, I've been practicing for about 16 years. This private practice, I just celebrated the 4th year anniversary a couple days ago.
Congratulations.
Thank you. It's kind of tough because 2 years into it, a pandemic started. So, but what was important to me is really kind of changing the face of podiatric medicine and surgery. A lot of people still have an, archaic ideal of what we do. We do a lot more than what people realize. So, with the advent of social media, it's been able to open up those doors, eyes to what we do, the extent, it's really, a lot of people will tell me, oh, I didn't realize you could do that. I didn't realize you did surgery, or I didn't realize, you're doing stem cells. So we're trained in everything. Even though we specialize in the foot and ankle, just like many other, specialties, you're trained in whole body, but you specialize in one area. We do the same thing.
Gotcha. So where did it start? You're a native of Houston, but I think you went to Michigan for college. Is that right?
Yeah. So born and raised 3rd Ward here in Houston, Texas. So if anybody out there listening from Houston, I'm from the Trey. Girl from the hood makes good. So very proud 3rd Ward, But yes, I did go to University of Michigan. At the time, I was interested, actually, they had an accelerated BSMD program, which is now defunct. But it was called Inaflex at the time. This was many, many moons ago. I'm not going to age myself, but it was a while ago. But that's what actually got me interested in that program. And there was actually one here in Houston as well that was a integrated BSMD program with University of Houston and Baylor. But anyway, I digress. I loved Michigan, and actually I got interested in sports medicine. They happen to have an athletic training program, where you can get a lot of, as a student athletic trainer, get a lot of hands-on, a lot of clinical experience. And I mean, it was perfect I have an athletic background. I was a cheerleader for University of Michigan. So, I mean, it was just a perfect fit. And that's actually what piqued my interest in foot and ankle, because there's a lot of foot and ankle injuries in sports. Contrary to belief, a lot of people think that podiatrists become podiatrists, just because they have a foot fetish or love feet or love nails.
I've never heard that
whatever.
Before, but
yeah. Anyway, but it's a sports medicine, which kind of highlights what I do today, because I do, take a different approach when it comes to treating my patients. I do tend to target a lot of the athletic and sports population with some of the treatments I offer today. So, I mean, and I still do some of the traditional stuff, obviously, I offer that, if someone's like, hey, I got an ingrown. I mean, obviously I can do that, but definitely, like I said, just kind of opening, the doors to other things that's out there.
That's fantastic. And I could see that athletic background kind of coming through in how you practice and how you target your social media. And I wonder, as you were finishing up at University of Michigan, you were a student athlete, how did you start to prepare for graduate school? Were you thinking podiatry at that point in time?
Actually, not until after graduating University of Michigan. So my bachelor's is in athletic training. I was part of school of kinesiology. So, it's all movement science, exercise phys, so like I said, a very heavy sports medicine type of background. I was an athletic trainer for high school and semi-pro football back here. And again, a lot of foot and ankle injuries. And I never really thought podiatrist or podiatric school or anything specifically until one of the security guards or that used to work some of the games. We were talking about it, and he was like, "You should consider this," and that's kind of what led to it, to be honest.
Really?
Yeah. Because a lot of the training, so, I still take the MCAT, you still, do all this stuff. A lot of people are kind of unaware of what the training is. Yes, you go through your 4 years of undergrad. Yes, you take an MCAT. At the other time, I think you could take, I couldn't remember. I mean, we all took MCAT. I mean, my class did, but it's 4 years of podiatric school. Then it's now I think it's 4 years, 3 to 4 years of surgical residency. So we're all surgically trained. Back in the day, like years before me, you could choose if you wanted to just specialize in medicine, like the podiatric medical aspect, and not do surgery. But now it is strictly podiatric medicine and surgical residency. So I think it's upgraded to like 4 years. I think it used to be 2, and then it went up to 3. Now it's 4. They keep trying to outdo each other. I'm like, come on.
Yeah, no, that's a lot. That's a lot of training.
It is.
So you went from Texas to Michigan, back to Houston. That's where you're doing the athletic training. And now you applied to podiatry school back up north.
Yes. So that's where, it's Rosalind Franklin University of Medicine and Science. And that's where I was spending the 4 years there. Then I came back and matched my residency here at West Houston Med Center, completed surgical residency here, and then joined a group in Connecticut. At the time, I was in Connecticut for about 7 years. I can live anywhere.
I see.
My talents took me back down south. No,
right.
And at the time, when I came back, I joined an ACO, like a large, hospital system, because when I was in Connecticut, I was with a multi practitioner group. We had about 3 or 4. No, we had 11 docs over like 5 or 6 offices across Connecticut.
Wow.
So I was in North Haven, which is right outside of New Haven, and I was in Fairfield, which is kind of near Milford and Greenwich, Connecticut. And so that was private practice. I was an associate, When I came back here, I said, you know what, I want to give the, just kind of large system a try, or you're not worried about, partly running a business. I mean, I didn't have as much overhead as that, because I was independently contracted as an LLC, but an associate nonetheless. So I said, you know what, let me just try to join, one of the groups. I mean, one of the large hospital systems. And I found that me personally, because I'd already gone through, the autonomy of kind of running, your own business.
Yeah.
and being able to practice and do the things kind of that you wanted to do. I didn't experience that as much. And it was just, I wanted to be able to offer my patients something different. And, so it wasn't the fit that I was looking for. So I was there maybe 2 years, maybe a year and a half. And I was like, you know what, I want to be able to do more. At the time, I remember talking to my colleague, saying, I just don't feel like I'm making a difference, with the way that, that system was designed to run. So, the stuff that I do now, I could never, have the opportunity to do those things in that system. So I felt like, just opening up my own practice was going to be a better fit for me, for sure.
And we're definitely going to have to talk about Soul Aesthetic down there in Bel Air / Houston, Texas. I got a question for you. When you spent all this time up in the Northeast, your Houston accent, did that get better or worse, stay the same? What do people say?
What's funny, because nowhere, everywhere I've been, no one's ever suspected that I'm even from the South. And I've never really had it. Yeah, well, they all expected to have a Southern drawl. I never had it. I don't know. It never got worse. It never, I think that there may have been times if I, for some reason, had a patient that was also from the South, if it came out, and just the y'alls, but that's pretty much it, but other than that, no.
Awesome. Let's go back to podiatry school. So you were at Rosalind Franklin up in Chicago. I did residency in Chicago, so spent some time there. What kind of things did you learn? What were the different rotations that you went on?
We did every rotation. It's very, we shared classes with, the PAs and the MDs and the not the DOs, but PAs and the MDs. So we learned all the same stuff. Like all our base work was, we're all taking gross together. We're all, taking farm together. Like it was all integrated classes because we all had to learn.
Is it the first 2 years mostly in the classroom and then?
Right.
Got you.
So first year's in the classroom, and then everything is exactly the same for all of us. MDs include that first 2 years, and then that's when we start to kind of break up a little bit, because obviously, we, like, say in gross dissection, we're doing head to toe, but after that first year's in, we're obviously going to do everything from the hip down. And look at everything from the hip down. I just, and as far as like rotations, obviously, then it's more specialized. So the difference, I would say, is that we just tend to specialize by the time we graduate, and MDs and DOs are specializing after internship. You know what I mean?
Gotcha.
Does that make sense?
So during those 2 years, you went to different hospitals and kind of, what were those rotations like?
The same, you're doing, ER, we're doing, surgery rotation. You're trying to make me remember all this stuff from 20 years ago. Whatever you did, we did it. No, same thing, Gotcha. Same rotations, derm and medicine and hospital. And, I remember doing all that, as a student, yes, in our little short white coats, doing all the same thing, doing.
So I guess it's fair to say you've successfully repressed all the trauma of medical school.
Absolutely. There's some. I definitely remember. We did everything. You go through all the same rotations. So yeah.
Let me ask you about your experience as a Black woman in this field. Did you ever feel discriminated against or that you were treated differently?
Yes. Yeah. Absolutely. Especially in this field, this specialty, there's not a lot of us. In my graduating class, there were 4 Black women, out of a graduating class of, I think at that time, I can't remember, I think maybe 60 something, 70, 80. I don't remember. It was 4 of us. There was 6 Black African Americans in total. So 2 guys and 4 girls. So, definitely, a huge minority in this field. And that's another thing. That was one of the things that I kind of strive on is changing the face, literally and figuratively of what we do. A lot of people do not see me, or doctors that look like me. So I do get a lot of the rising students and rising doctors, message me and, because it's something, they see, a relatable face and they're like, oh my God, she's doing it too. So, and like hats off to people like, Ebony, Dr. Ebony, on the show or whatnot. It's great to have more representation. There was not a lot of role models at all.
Yeah.
There still isn't, but we're slowly, out there. I mean, we're, creeping on the come up. So, but yeah.
Yeah, it's fantastic. And with your private practice, you can really like shape and demonstrate some of the things that can be done in this field. And thank you for taking us through your work background. You kind of moved around a lot, came back to Texas, and a couple years ago, you opened Soul Aesthetic. Can you talk to us about your practice?
Sure. So the whole idea behind Soul Aesthetic is basically wanting to bring forth, podiatric medicine, aesthetic medicine, and regenerative medicine under one roof. So people don't really associate either aesthetic or regenerative medicine with foot and ankle at all, let alone podiatry. And the reason I say podiatry in quotes, because and that's one of the things when I talk to people and they ask me, what do you do? A lot of times I'll say, either podiatric medicine and surgery, or, foot and ankle. And, they kind of like, really, what is that? What is that? And then if I say podiatrist, people know. But when you say podiatrist, the only thing that people associate the word podiatrist with is
diabetic toes.
Yeah. The nails, fungus, and corns and calluses. and not saying that, no, I mean, obviously we know what those are medically and, and how to treat and assess them and whatnot. But that is 1% of what, we can do. I mean, what we're capable of, what I'm capable of. So it really kind of diminishes it. And then, it leaves having to explain more. So that was one of the reasons I wanted to open my practice, was to offer that to a population who doesn't realize it was out there and available. When it comes to aesthetics, we offer, Botox, we offer dermal fillers, those type of things, to the foot and ankle. So,
hang on. You said Botox and fillers.
Yep. So Botox, remember, can be used for hyperhidrosis, right? Or no, are you not familiar? Okay.
Sweating.
Exactly.
Sweating.
Right. So, right. And so Botox has been used. We know how the function is. Well, we also know that it was obviously used off label for wrinkles anyway. And that's how it started until it was used long enough. And then it became, labeled use for, wrinkles. But it's also been used for hyperhidrosis for years, for palmar hyperhidrosis, axillary hyperhidrosis, and obviously plantar hyperhidrosis. So that's not new. We've been doing Botox to the feet for years. It's just never been marketed. So
I had no idea.
Exactly. So a lot of the things that I do is basically not necessarily new, but or some is innovative, but plantar hyperhidrosis are used for Botox for plantar hyperhidrosis is not new. They've been doing that for years before I started practicing. They don't ever market it. So that's where being, in this position and being able to use social media and other things and say, hey, this is still a business, and a business we have to market, and you have to pull a certain, demographic. I mean, I'm in the South. We sweat. Feet sweat. How do you know the number of people who would be interested in treating plantar hyperhidrosis? Because if you don't treat it, it leads to, bacterial infections. It leads to fungal infections. So obviously, there's a market for it. But if you don't know, if someone doesn't know it exists, they're not going to ask for it. So it's a lot of marketing and creative marketing in what I do as well. It's definitely targeted. But yes, so Botox for that. So obviously it's not wrinkled feet that you're thinking about. The dermal filler part. So dermal filler, think about it, is typically, everyone knows about dermal fillers. It's a buzzword now. Everyone knows about hyaluronic acid. You've got, stars on commercials for Revlon or whatever saying the words hyaluronic acid. So a lot of it is a lay term now. So what we use that for is basically creating volume or filler at the bottom of the foot where there's fat pad atrophy. So it's not about, and women, or men or whoever is looking for it, use it to plump up cheeks or plump up lips, whatever. So there are areas at the bottom of the foot, like if you're the metatarsal pad or anywhere where you've lost fat. and it hurts now because just standing and walking, fat pad atrophy is very common in women over the age of 40. So it becomes painful to wear certain shoes, or it didn't even have to be a woman. I mean, I've got patients who have undergone dermal filler injections in their 70s because absolutely, when you're at that age, you're going to lose fat. It's like your brake pads wearing thin. You lose fat in your feet. It hurts to walk. It's like walking on skin and bone. You add in dermal filler, injections to the area, and it's like they're walking on cushion. They love it.
Wow.
Is this something that's covered by insurance? Nope. This is considered cosmetic. Same thing with the Botox. It's not covered by insurance. This is something you're paying for out of pocket. But, the patients who have undergone it, I mean, it's so worth it to them. And of course, it's something temporary. This is not, just like women have to keep going back to upkeep. It's the same thing, Yeah. But that's part of the aesthetic part of it. And of course, aesthetics, does kind of go into the surgical cosmetic surgery. But a lot of times when we're doing surgery, even though people may not like the look of toe deformities or foot deformities, it usually is or typically is associated with pain, so those things are covered by insurance, because a lot of people ask,
Gotcha.
well, just because I don't like the way my bunion looks, is that cosmetic? I'm getting cosmetic. I'm like, well, it's a deformity and it hurts. So that's different, so that's where it becomes that's that podiatric orthopedic type surgery, when we're doing it's basically, reconstruction, surgical correction.
Yeah. I think you mentioned some stem cell work as well.
Right. So that's the regenerative medicine aspect of the practice. That is something I'm just near and dear. I love it. Patients do amazing with it. I mean, regenerative medicine is the future of medicine. People do, they're aware of what a stem cell. They may not know exactly, how it works or where it comes from, but they hear those terms. In biologic therapy, not just stem cell, people have used placental tissue matrix, amniotic, tissue matrix, all this stuff for years. Again, it's not as innovative as me, saying, hey, I'm doing this. Like, oh, you're the first. And I'm like, well, not necessarily. I may be the first foot and ankle specialist in Houston doing it, absolutely. But it's been done. This is not new, but it does, bear some, making sure that people are educated properly on it. Patients are educated properly, because when it comes to stem cell only comes from, your own bone marrow or adipose tissue or first generation relative. You cannot buy stem cell from a store. You cannot buy it from a rep. You cannot go to a special clinic and say, I got a stem cell injection. I'm like, well, did they aspirate it from your bone marrow? Because if not, you most likely didn't get it. So,
there's places that are
they'll say stem cell. Yeah. So you have to be, when I first, the FDA will flag you in a heartbeat. I got flagged, not that I was doing something wrong, but that they know that I was putting it out there. And they're like, well, just so you know, we're watching you, because you cannot they will shut you down. You cannot say I'm doing stem cell and not be doing stem cell. So that's really important. So, when I first started, I made sure to only use terms like biologic therapy and everything until I was comfortable in promoting stem cell and say, yes, I'm actually doing it. I mean, you can go on my, page and watch me do it. It's a system I work with, Selling Biosciences, who's amazing. They have amazing, education and technology behind, science behind what they do. So I basically exclusively work with them, and stem cell has so many applications. And so the reason, I do it instead of using any other biologic products is because it's coming from yourself, So, and like I said, I try to explain to patients. So, our bodies have the natural ability to heal. So we're just tapping into that. Obviously, as we mature, that ability to heal is less, available. So we're tapping into it. We're spinning it down into a concentrated product, which is just you, and people also hear of PRP. So platelet rich plasma, which is something I also do. That is not stem cell, but it is considered regenerative medicine. Your platelets aren't stem cells. Your plasma is stem cells, okay. They're not progenitor cells. I mean, if you remember way back in your cell biology courses, right. Oof. You'd have to go back a couple years, I'm sure. But PRP is done in the office. I draw your blood. We spin it down to a platelet-rich plasma, injection, and patients do well with, amazing with that too. It's it's basically, it's treating chronic pain and inflammation. When you are, when we're doing the stem cell injections, we're basically trying to kickstart, chondrocyte regeneration, collagen regeneration, in damaged tendons, chondrocyte and damaged, joint surfaces. It's worked well in, knees. I mean, this is hips. I don't do knees and hips, obviously, that's not my scope, but, this is something that, again, it's not new. It's just now gaining more exposure. And again, with social media and with advertising and marketing, then people are realizing that it is out there. And one of the pluses is that, there's little downtime. We're kind of trying to transition away from some of the old school medicine, the anti-inflammatories, the steroid injections, those type of things, because, long-term use, obviously we know they have deleterious effects on the body. So, it's okay in some acute inflammatory situations, but in my, field, I get a lot of patients with chronic inflammation, chronic pain. I'm not going to sit here and throw another ibuprofen 800 at you. That's not going to do anything. What I'm going to tell you, stop working out, stop running, stop living your life, so there's no more is, I'm not the type of doctor where you got a woman coming in and she wants her lifestyle. She wants to wear heels, or she's corporate. She has to dress a certain way. I'm not going to tell her, okay, well, sorry, you got to get into some orthopedic sneakers now, So that is one of the reasons I'm doing what I'm doing. And I love it. I absolutely love it. Giving patients options. Life is about options, and they have way more options with me than they may with another, specialist.
Well, if you're out there in the Houston area, or if you feel like traveling to Houston to get your feet worked on, visit Soul Aesthetic in Bel Air, Texas. You can also follow Dr. Barrow on her Instagram, Soul Aesthetic Texas. We'll put links in the show notes because it's spelled SOLEAESTHETICTX. But we'll put the link in the show notes so you can follow her there, and definitely check out her page, because again, she is changing the game of podiatry. Before we started speaking, I thought it was all diabetic toes. Clearly, it's much more than that. And if you go to her page, you'll see, in addition to managing this very busy and chic practice, Dr. Barrow is also very interested in fitness and fashion, and kind of incorporates all of that into her aesthetic. So can you talk about that part of yourself as we close, the fitness and the fashion aspect?
Well, fitness, I mean, I've always been, a proponent of, fitness and being the example, of what patients, want to see. I mean, obviously being a role model for my patients, and especially, like my runners, a lot of times they'll go to doctors who don't understand running, and they'll tell them, well, you got to stop running for 8 weeks if you want this to get better. And that's not the case. They have way more options than that. And I understand what it's like to be injured and not be back in the gym, or not, be back on the road, or, the trails. So that being able to relate to patients like that is invaluable, because that's what they're looking for. And, when it comes to fashion, a lot of times, I mean, obviously, again, I am not the picture of what, people think about when, they think of podiatry or whatnot. A lot of times they'll see me in heels. They'll see me, they're like, oh, you're wearing heels. And I'm like, well, yeah, I mean, the heel isn't the bad word here. How about we find out what's actually going on with you and address the problem instead of throw away the heels, because a lot of times it's not, or maybe that's not the heel. Maybe we need to talk about shoe type. We need to talk about this. We need to talk about that, so I've had patients who haven't been able to wear heels for years because of an injury. I had a patient, she was in her 70s, and she's active, active. I mean, you got to understand, people are more active at a later, I mean, you see this all the time, I'm sure, people are active at later stages in life, as opposed to, a 70-year-old running, a 70-year-old wearing heels is nothing. I mean, that is the future that we're heading towards, because we are living longer. We are, taking more control of our health, our lifestyle, our fitness, our lives. So we do see this, a lot. Not all of my patient population is elderly. I do have a younger population as well, but I digress. She, wanted to get back in heels. She had, a chronic secondary, osteoarthritic midfoot injury. We did PRP with her, within 4 weeks, she was back in heels. She was happy. Her husband was like, thank you. She's so happy, and this is something, so there's so much more to what, that human aspect of it, and I think that doctors there's a lot of practitioners out there who don't look at that. Don't look at the big picture. One of my posts today is kind of the same thing. And I said, I may specialize in foot and ankle, but I evaluate everybody from head to toe. And you got to take, the person, into, the equation. And a lot of times, we don't do that. You know why? Because in a lot of those systems, there's no time to do that.
Right.
I've been in systems where I had to see, I was seeing 42 patients a day, 2 patients booked every 10 minutes. There's not a time to sit there and talk about, so what do you like? You walk in and you're like, you want pills or shot? Which one is it? What paperwork do you need me to sign? What FMLA papers do you want me to sign? I've been in that situation before. This is different.
Yeah.
You get to know the patient, as a whole and not as a body part, obviously.
It's fantastic. Well, Dr. Barrow, I cannot thank you enough for coming on the show and sharing your specialty, your practice, this incredible field of podiatry. For the listener, can you tell them how they can get a hold of you, how they can find out more?
Okay, so if you're in the area, obviously I'm in Bel Air, just inside the Loop, 5959 West Loop South. You can always find me on my website. There's a lot of information about what I do. You can read up on stem cell and regenerative medicine and aesthetics and surgery at soulaesthetics.com. It's SOLE because soul is the foot and aesthetic is what we do. tx.com. And of course, I'd love for you to follow me on social media, on Facebook, on LinkedIn, on Instagram. I'm able to post a lot of things on there, especially in Instagram. If you're interested in seeing some of the procedures that I do, you definitely can take a look at that and DM me anytime. One thing that's important to me is to be able to have that connection with my patients, and anytime I'll message you back.
Awesome. Well, thank you so much for joining us on the Black Doctors podcast, because representation matters.
Absolutely.
The Black Doctors podcast is a nonprofit, volunteer passion project with the goal of inspiring all who listen. If you enjoy listening, tell a friend about the show or share a link on social media. We are a small team and can use all the help we can get. You can reach us at the Black Doctors podcast on Instagram or at Stephen Bradley MD on Twitter or Instagram. Tune in next week for another episode of the Black Doctors podcast, because representation matters.